Thank you. President Obama promised the Affordable Care Act would create a vibrant, highly competitive market that would lower the cost of insurance. That hasn't necessarily happened. Why did that not fail to come to pass?
You know, I think the question is where it has happened, how much it has happened. Because for all of us, as I said, I think mostly in this room, the 150 million folks who have insurance through your employer, in 5 of the last 6 years, your premium growth has been the lowest that has been recorded. And so in terms of helping with the costs, we know that Medicare spending has been much lower than was predicted, over $300 billion lower than was predicted before the Affordable Care Act. And we know for many Americans who are in the marketplace that coverage is affordable right now, and it is open enrollment, and I encourage anyone who has not signed up to go shop, check for yourself, and see if you can find a plan, because over 70% of folks in the marketplace find a plan for $75 or less a month in premiums. And so, is it complete? Do we need to do more on affordability? Absolutely. That's why we'd like to suggest a public option that would create competition and downward pressure on price. It's why we also think it would be great if the Secretary of Health and Human Services had the ability to negotiate on high-cost drugs. And so those are the kinds of things. But in terms of has progress been made, yes. We've saved billions from reducing the number of readmissions. Often, I think we don't also include in the conversation, one of the things the Affordable Care Act did was it gave us tools to try and experiment for cost savings for the whole system. And so we've reduced the number of readmissions. When people have to go back into the hospital, that's bad for individuals, it's costly for the system. Reduce those dramatically. In addition, have been able to do things like create models. HHS, CMS, the Center for Medicare and Medicaid Services, worked with the YMCAs across the country and did a program to lower those number of people who are pre-diabetic that become diabetic. The average savings over 15 months for the individuals was over $2,600, and they lost 5% of their body fat. Those are the kinds of things that are the long-term changes we need on affordability.
You brought up several topics that we're going to get